This is a presentation of Aware's AccuRad REM Server. The purpose of the server is to capture patient radiation dose from diagnostic studies and understand what is going on within a facility based on radiation dose collection. On the collected data screen, we see the actual dose instances that have been collected from each machine. These can be standard radiation dose structured reports, proprietary Diacom objects, or screen scrapes of standard dose screens. This server allows data to be received every time X-ray tubes are turned on. In addition to CT, the server also supports IR and fluoroscopy. In short, the data is received, pulled apart, and pushed into our analysis engine. Here's a quick view of what that can do. So you'll see, as we discussed, there is CT, there is projection, and we also support mammography projection, including fluoroscopy. If we look at CT, we can create a report to look at any information we want. If we want to look at dose distributions in a histogram, we can do that. So let's see what the CTDI distributions look like for the past 30 days for females who got head without contrast. So here we can see distribution. This again is CTDI vol for females who got head without contrast. We can see a nice tight grouping that we like to see with heads. A couple studies maybe we had to repeat, and one outlier that we might want to look into. The next step is to bring all that information into the dashboard. We've picked a patient view which will show the most irradiated patients and how often they've been through. This particular sample stock is all one study, with a few series per study. In equipment utilization, we can view our 2 CT machines and what rate they perform studies per day over the past month. Over here, we're looking at the average CTDI vol for a particular protocol for the past quarter. Here, we can see the same distribution that we were looking at for all the patients, this time for all the patients over the past year, which allows us to get a quick feel for what's going on. We have a similar dashboard projection for X-ray as well. With more advanced features for sites where modalities report different protocol names for the same protocol, we allow institutions to map those under a single name. For instance, if the titles head contrast, head W contrast, or head with contrast were entered into the server, each of these can be mapped under the encompassing name head with contrast, so that all of the data can be displayed properly. We also allow the creation of custom names for machines. Here you'll notice are the machines titled Emergency Department CT and South Wing CT. While the server identifies the machine by their uniquely identified serial numbers, users can create custom names that are easier to understand and differentiate between. Of course, all of the accesses and changes are logged, so if needed, we can go back and see who has done what and who has interacted with what pieces of the system. We have integrated user management, which means all of the tabs are access controlled by privileges and they're customizable per site, so different users can have a different set of tabs. We can also delegate all of the user authentication to LDAP servers or Active Directory servers, so that our system doesn't need to maintain that state. This has been a presentation of Aware's AccuRad REM Server.